So pathology is a very vast subject and it is very hard to remember everything in pathology. So we are coming up with notes of pathology and we have made everything simpler and you can get it on Telegram also. So we are starting with acute myeloid leukemia. Leukemia means it is a cancer of the blood. It is a very simpler term. And start with acute myeloid leukemia. There are two types of myeloid leukemia, that is acute and chronic. In acute, what is acute myeloid leukemia? It is a heterogeneous disease characterized with the infiltration of malignant myeloid cells in the blood and bone marrow and other tissues. It is a definition. Then it is more common in the age group greater than 50 years of age. Pathogenesis. Acute myeloid leukemia developed due to inhibition of maturation of myeloid stem cells due to mutation. That is mutation, that is translocation. Translocation from 15th and 17th chromosome, translocation from 8th and 21st chromosome, and inversion of 16th chromosome. This is pathogenesis of acute myeloid leukemia. Next is FAB classification. It is divided into 8 types, that is M0 to M7, and it is very simpler classification. And M0 all rods are absent, and in M3 all rods are maximum. So what are our all rods? We will see in the upcoming video. Then M0, it is minimally differentiated acute myeloid leukemia. M1 is acute myeloid leukemia without maturation. M2 is acute myeloid leukemia with maturation. M3 is acute promyelocytic leukemia. M4 acute myelomonocytic leukemia. M5 acute monocytic leukemia. M6 acute erythroleukemia. M7 acute megakaryocytic leukemia. So it is like minimally differentiated acute myeloid without maturation, with maturation. Promyelocytic, myelomonocytic, monocytic, erythro and megakaryocytic. You remember these middle terms, you can easily remember the FAB classification of acute myeloid leukemia. Next, clinical features of acute myeloid leukemia are: due to bone marrow failure, it is same as that of a chronic myeloid leukemia. There will be myeloid proliferation in the bone marrow. Due to organ infiltration, and there is replacement of the marrow and other tissues by the leukemic cells. There will be pain and tenderness of the bones, lymphadenopathy, splenomegaly, hepatomegaly, and gum hypertrophy in acute myeloid leukemia. Next, coming to the lab diagnosis. And in blood picture, there will be anemia, thrombocytopenia, and thrombocytopenia is decrease in the platelet count, where white blood cells exceed greater than 1 lakh per microliter. And we can see myeloblastic cells with OR rods present. Now, next, what are the myeloblasts and OR rods? Myeloblasts are the large cell with round D-shaped nucleus with fine chromatin and 2 to 4 nuclei and scanty cytoplasm with fine granules. Myeloblast means it is a precursor of a myeloid. Okay, blast means precursor. Next, OR rods. What are the OR rods? OR rods are the crystalline cytoplasmic inclusion as a result of abnormal fusion of azurophilic granules. OR rods are the crystalline cytoplasmic inclusions as a result of abnormal fusion of azurophilic granules. Now coming to the bone marrow examination. On bone marrow examination, we will see hypercellularity, that is myeloid hyperplasia. Myeloid hyperplasia means myeloid to erythroid ratio will be increased as myeloid cells are increased. Next is leukemic cells. Marrow is tightly packed with leukemic blast cells, and myeloblast makes up more than 20% of the cells in the marrow. Means bone marrow will be completely filled of myeloid progenitor cells like myeloblast, and there is myeloid hypertrophy, not hyperplasia. Hyperplasia means increase in the number of cells. Cytogenetics. M3 cases have translocation of 15 and 17, and M4 have inversion of 16. Means it is important to know for MCQs. Cytochemistry. There are 5 stains. It is a 3 marks question also, like what are the stains for acute myeloid leukemia. There are 5 stains, that is myeloperoxidase, Sudan black, non-specific estrase, and periodic acid SIF, and acid phosphatase. Myeloperoxidase is positive for immature myeloid cells containing OR rods and negative for M0. Sudan black is positive for immature cells in acute myeloid leukemia. Non-specific estrase is positive in monocytic series. Periodic acid SIF, it is negative and positive only for M6. Acid phosphatase is negative and positive only for M4 and N5. These are most cytochemistry is important for MCQ purpose. You specifically remember these 5 stains, that is myeloperoxidase, Sudan black, non-specific estrase, periodic acid SIF, acid phosphatase. This is a pathological diagram. You can see myeloblast cells with OR rods present. It is a characteristic of acute myeloid leukemia. OR rods are seen in acute myeloid leukemia, and you can see myeloblast cells and myelocyte. So with this we end our video. See you in the next video. Until then, Jai Hind, Jai Bharat.